Expectorants are drugs that help in removing the mucus, that is phlegm, from the airways. Expectorants are used in wet or productive cough where mucus is thick and difficult to expel. In infections, mucus becomes thick and sticky. Thick mucus blocks the airways. It becomes difficult to cough it out. Expectorants increase the amount of watery secretions in the respiratory tract. This makes the mucus thin and less sticky. Thin mucus can be easily coughed out. This causes mucus to loosen, airways become clear, and breathing becomes easier. It is like adding water to thick glue so it can flow easily. Examples of expectorants are Guaifenesin, ammonium chloride, potassium iodide, etc. It is important to remember that expectorants do not stop cough. They help cough become effective. They are best used with adequate fluids. Use expectorants for productive cough only. Do not combine them with strong antitussives. So, to conclude, expectorants act by increasing water secretions in the airways, thereby thinning mucus and helping it remove easily. Now we will discuss about mucolytics. Mucolytics are the drugs that reduce the viscosity of thick sticky mucus, making it easier to cough out from the respiratory tract. They do not suppress cough. Instead, they improve mucus clearance, making the cough more productive and helping patients breathe more comfortably. Some commonly used mucolytic drugs are Acetylcysteine, Bromhexine, Ambroxol, Carbocisteine, etc. Now let's understand the mode of action of mucolytics. Normally, mucus contains long chains of proteins called mucoproteins that make it thick and sticky. Mucolytics work by breaking down these mucus components, thereby reducing its thickness. Different mucolytics act in different ways. Acetylcysteine breaks the disulfide bonds within mucoproteins, rapidly liquefying mucus. Bromhexine and its active metabolite Ambroxol stimulate the production of thinner respiratory secretions and enhance mucociliary clearance. Carbocisteine modifies mucus composition, making it less viscous and easier to remove. Carbocisteine modifies mucus composition, making it less viscous and easier to remove. As the mucus becomes thinner, the cilia lining the airways can transport it more effectively towards the throat, where it can be coughed out or swallowed. Mucolytics are usually useful in conditions associated with thick and tenacious sputum, such as chronic bronchitis, chronic obstructive pulmonary disease, bronchiectasis, cystic fibrosis, some cases of pneumonia with excessive secretions. They help improve sputum clearance, reduce airway obstruction, and relieve chest congestion. Mucolytics are generally well tolerated. Some patients may experience nausea, vomiting, gastric irritation, or mild skin rash. Nebulized acetylcysteine may occasionally cause bronchospasm, especially in patients with asthma. Therefore, it is often administered with a bronchodilator when necessary. So, to summarize, mucolytics are drugs that reduce the viscosity of mucus, making it easier to clear from the airways. They are widely used in respiratory diseases with thick secretions and help improve breathing by promoting mucus clearance. Mucolytics should be used cautiously in patients who cannot cough effectively because excessive liquefied secretions may accumulate in the airways. Understanding their mechanism, examples, uses, and important precautions is essential for both pharmacology examinations as well as in clinical practice. So, this was all about mucolytics. Now, let's understand about antitussives. Have you ever wondered why some cough syrups stop coughing almost immediately while others don't? The answer lies in a group of drugs called antitussives, commonly known as cough suppressants. Now we'll understand what antitussives are, how they work, and when they should be used and when they should not be used. What is cough? Cough is a protective reflex of the respiratory system. Its main function is to remove mucus, dust, microorganisms, and foreign particles from the airways. The cough reflex begins when receptors present in the pharynx, larynx, trachea, or bronchi are stimulated. The impulse travels through the vagus nerve to the cough center in the medulla of the brain. The brain then sends signals to the respiratory muscles, producing a forceful expiration that expels the irritant. Therefore, cough is actually a defense mechanism and should not always be suppressed. It is important to remember, never suppress a productive cough unless absolutely necessary. Now let's understand about antitussives. Antitussives are drugs that suppress the cough reflex. They are mainly indicated in dry, irritating, non-productive cough where coughing serves no useful purpose and causes discomfort, sleep disturbance, or chest pain. Antitussives are broadly classified into two: central acting antitussives and peripheral acting antitussives. Centrally acting antitussives. They suppress the cough center in the medulla. These drugs decrease the sensitivity of cough center located in the medulla. As a result, the threshold for initiating cough increases, reducing both the frequency and the intensity of coughing. Examples include codeine, Codeine, Dextromethorphan, noscapine, etc. Codeine and Codeine are further classified as opioid antitussives, while Dextromethorphan and noscapine are classified as non-opioid antitussives. Codeine acts on mu-opioid receptors in the medulla to suppress the cough reflex. Although highly effective, it causes sedation, constipation, respiratory depression, and dependence. Dextromethorphan is the most commonly used non-opioid antitussive. It suppresses the cough center without producing significant analgesia or addiction at therapeutic doses. It has much better safety profile than codeine. Now let's understand about peripherally acting antitussives. These drugs act on nerve endings in the throat and airways. They reduce stimulation of cough receptors in the respiratory tract. Basically, they reduce irritation at the site, that is in the throat and airways. As a result, fewer signals reach the cough center. So, the throat becomes calm and coughing is reduced. Examples include benzonatate, demulcents like glycerin and honey, local anesthetics such as lignocaine used before bronchoscopy, Levodropropizine. Now, Levodropropizine inhibits activation of airway sensory nerves. Benzonatate anesthetizes stretch receptors in the bronchi and lungs, thereby reducing the cough reflex. Antitussives are useful in dry cough, allergic cough, viral upper respiratory tract infections with troublesome cough, nighttime cough disturbing sleep, post-viral cough, lung cancer causing persistent cough, etc. They should generally be avoided in productive cough because suppression of mucus clearance may worsen infection. Like all other drugs, antitussives also have adverse effects. Codeine shows drowsiness, constipation, nausea, vomiting, respiratory depression, dependence and addiction, and tolerance with prolonged use. Dextromethorphan shows dizziness, drowsiness, nausea, gastric discomfort. At very high doses, it may also cause hallucinations, euphoria, and has abuse potential. Benzonatate causes numbness of mouth if chewed, hypersensitivity reactions, and in rare cases bronchospasm. It is important to know, avoid combining opioid antitussives with alcohol or sedatives because the risk of respiratory depression increases. Antitussives should not be routinely used. in productive cough, bronchiectasis, pneumonia with copious secretions, young children, especially opioid preparations, patients with severe respiratory depressions. So, to summarize, antitussives are drugs used to suppress troublesome dry cough. Antitussives suppress cough, they do not treat its cause. They are classified into centrally acting and peripherally acting antitussives. Central acting drugs like codeine and dextromethorphan act on cough center in the medulla. Peripheral drugs such as Levodropropizine and Benzonatate reduce stimulation of cough receptors in the airways. Although highly effective, they should be used judiciously because cough is an important protective reflex. The underlying cause of cough should always be identified and treated whenever possible. So, this was all about antitussives.